Causes of secondary glaucoma. Glaucoma is an eye disease that develops when eye pressure damages the optic nerve. In secondary glaucoma, an existing condition or other outside factor causes eye pressure to go up enough to cause this damage. In primary glaucoma, this happens without any outside factor. The medical term for eye pressure is intraocular pressure, IOP. Maintaining a certain level of IOP is very important for vision and overall eye health. IOP that is too low or too high can cause serious problems, and everyone's ideal IOP is slightly different. The aqueous humor is produced behind the iris, flows into the anterior chamber through the pupil, and exits the eye, between the iris and cornea. Too much aqueous production, or obstruction of its outflow, causes a rise in IOP that can lead to glaucoma. Fortunately, the aqueous humor in our eyes usually keeps IOP balanced for us. It does this by flowing into and out of the front part of the eye at a constant, steady rate. If this steady flow slows down or stops, IOP can rise enough to lead to glaucoma. In most cases, this happens because aqueous humor can't drain from the eye quickly enough. It can also happen if aqueous flow is restricted earlier along its pathway, or if the eye produces too much aqueous humor. In primary glaucoma, there is no identifiable cause for these issues. With secondary glaucoma, there are known, specific factors directly affecting aqueous flow and IOP. These factors fall into 5 broad categories. Underlying health conditions. Eye infections or inflammation. Previous eye injury. Eye surgery. Medication side effects. Secondary glaucoma can be acute or chronic, depending on its cause. It is much less common than the primary forms. But like primary glaucoma, it very rarely has any early symptoms.